See the attachments of the medial phalanx. On the dorsal aspect of the medial phalanx of the lateral four toes, here is attached middle slip of the extensor digitorum longus. Extensor muscle passes dorsally, and longus muscle ultimately it will be inserted into the distal phalanx. So on its way, it gives a slip, middle slip to the base of the middle phalanx. Now, on either side of the shaft, flexor digitorum longus is attached here on either side of the shaft of the middle phalanx, and along with the middle slip of the extensor digitorum longus, the tendons of the interossei and lumbrical also is attached here, and through extensor expansion, this interossei and lumbricals is attached here. So these are the attachments of the middle phalanx. Now come to the terminal phalanx. On the plantar aspect of the terminal phalanx of the lateral four toes is attached flexor digitorum longus, and on the dorsal aspect extensor digitorum longus, distal slip of the extensor digitorum longus. Here you see there is a bony projection from the base of the fifth metatarsal, which you can feel also on the lateral side of your foot. It gives attachment to peroneus brevis and peroneus tertius at its dorsal aspect. Peroneus brevis near the tip of this bony projection, and peroneus tertius on the dorsal aspect of this bony projection of the base of the fifth metatarsal. Now come to the ossification of the tarsal bones. Tarsal bones generally, their ossification center appears after 2 to 3 years of birth, except talus, calcaneum and cuboid. Their center of ossification starts before birth, that is intrauterine. The ossification for talus starts at about 6 months, calcaneum 7th months, and cuboid 9 months of intrauterine life. So let us consider some applied importance in relation to this articulated foot. One deformity is known as hallux valgus. Hallux valgus is a deformity where the junction of the first metatarsophalangeal joint, here the joint is deviated laterally. It is generally found in case of lady because of their ill-fitted shoes. When it once develops, it goes on increasing because of the pull of the flexor and extensor tendon of the hallux, and ultimately this joint develop osteoarthritis. Now come to the deformity in respect of arches of the foot. You know the foot has got two arches, longitudinal arch and transverse arch. This longitudinal arch again divided into two, medial longitudinal arch and lateral longitudinal arch. Out of this, if we see from side, we can easily appreciate the arch. The medial arch is raised than the lateral arch, and this arch is maintained by bony configuration, strength of the ligaments, and tone of the muscles. Out of these three factors, tone of the muscle is very important. If this tone of the muscle is due to any reason, because of long root march or for prolonged standing, if the muscle is fatigued, then the role of the muscle will be weakened, and therefore there will be collapse of the arch. And when there will be collapse of the arch, it will stretch the ligaments and it will cause pain. So these are the some applied importance of the arch of the foot. That's all.